host, Yulia Raja. Today we're going to discuss how shifts in federal refugee policy affect resettlement in Northern Nevada. This is our second episode of a newly rebranded podcast produced by the Northern Nevada International Center. This is where global stories meet local impact, where learning leads to connection, and where Northern Nevada comes together through dialogue. Our first episode, we discussed what is refugee resettlement and what is the definition of refugee. And NNIC's executive director, Dr. Karina Black, explained how resettlement started in Northern Nevada. So if you didn't have a chance to listen to it, please do. You're listening to the Local.Global.Nevada, the podcast where we connect Northern Nevada to the world by amplifying immigrant and international voices, bringing clarity to complex issues, and fostering dialogue that strengthens community understanding and trust. Through local stories with global perspectives, we show how diversity shapes and enriches our region. Brought to you by the Northern Nevada International Center. I'm your host, Yulia Raja. This is our second episode, and we will continue learning a lot about refugee resettlement and how local and international policies affect our work here at NNIC. So today we're going to discuss how shifts in federal refugee policy affect resettlement in Northern Nevada. We will discuss the policy changes with funding, processing times, and how this affects refugee resettlement and us, particularly NNIC, and how it affects our clients. We will be discussing our topic with one of the NNIC's employees who works at the refugee resettlement. Her name is Seraphine Onyango. Hello, Sarah.
Hello, Yulia.
How are you doing today?
I'm doing great. Thank you for having me.
Okay. Thank you so much for coming for our podcast and sharing the information about the work you do with us. So could you please introduce yourself a little bit, and why did you decide personally to start working with NNIC and particularly with refugees? What is driving your passion?
Thank you. I'm happy to be here. I'm happy to have this session with you, Yulia, and I'm grateful for this opportunity. And I'll introduce myself. My name is Seraphine Onyango, and I work with the Northern Nevada International Center on our refugee resettlement and integration services as a case manager. I've been working here at NNIC for close to 5 years. NNIC's mission is to build bridges of understanding and foster global engagement through international exchanges, refugee resettlement, and language access. Our work is about helping people who've been forced to flee their countries, and we support them with rebuilding stability when they get into the United States. We support clients with navigating key systems, connecting to community resources, and supporting successful start in Northern Nevada.
Interesting. That sounds really a lot. Like you do a lot of things here, right?
Yes, because this program is geared towards supporting the clients to become self-sufficient and to feel like they're able members in our community. And I accepted this offer because I wanted to do work that genuinely helps people and makes lives better. The most rewarding part is seeing that change happen in real time. When a family is no longer in crisis mode, when things become more stable, and when we see a seamless integration into the community. For example, kids get enrolled in school, adult family members getting employed, transportation is figured out by the adults on how to access maybe like employment, getting connected with healthcare, and people starting to feel safe and grounded.
That sounds really amazing, and I feel like it's a tough work to do. And thank you so much, Seraphine, for all your efforts and all your assistance that you provide NNIC's clients. Could you recall, like, how many clients you worked with, on average?
So there's, it depends. We have received a large number of refugees since this program began in 2016. I would say on a case-by-case basis, based on our case managers, you could be managing up to maybe 40 cases, and that's family members, not counting the individuals in these households.
So like 40 families at a time.
40 families at a time.
Oh my gosh, that's a lot. And do you have support? Like, do you have other case managers in the office?
Yes, we do have other case managers because the program, the way it's designed, we do have clients having arrivals, and the arrivals phase is very specific with very specific core services that we have to provide. And those have to happen within the client's 90 days. And after the 90 days, we move the clients to our refugee social services, where we have to support them for another 5 years because there's legal processes involved after that. There's clients getting to employment or getting rehired. So we are providing the support after that time period.
I believe this is a very good source for like all the people that we receive, because they always have the safe place to like back on, right?
Yes, the clients trust us a lot because we are their first face when they do arrive in the country, and we are giving them hope. We are giving them a way to know that we are here to support them through their journey. And so whatever we share with the clients, whatever we share about the programs, they are listening keenly because they know that's their key to becoming better within our community and integrating well within the community, accessing resources and whatever kind of help that they need. They know they can trust the agency to support with that.
This work sounds really massive, and with all these changes that are happening today on the federal level, it seems even more important. And we just learned today that our government withdrew from the dozens of international organizations, and so like with those big beautiful bill also that was signed in July 2025, there's so many changes happening today. So Seraphine, did you experience any service disruption, for example, on the NNIC level? Did you have any changes that right now causing all those things that are happening on the federal level? Please give us a little overview.
Yes. So when the national refugee admissions are sharply reduced, it affects resettlement agencies immediately because our operational capacity is tightly tied to arrivals and the structure of the federal program. Since the beginning of 2025, arrivals went down to historically low levels, creating a volatility across the entire resettlement infrastructure.
And also, you know what, Seraphine, I also heard that some experts are saying this is an incredible, insane shift in the whole policy and in general attitude towards resettlement and commitment of the United States into the resettlement since the Second World War. So the shifts that are happening are huge.
At the local level, what that looks like is fewer arrivals, means less predictability and harder time planning staffing and services. Even when the number of new arrivals drops, the needs of families already here do not disappear. So teams often end up trying to maintain essential support and tighter resources.
So does it mean you guys got now more time to work with existing clients, or how does it work right now?
We do have time to work because, just like I mentioned before, we work with the clients for a period of 5 years. So we are supporting on and off. It could be some are stable within the first 1 year, or somebody could be stable, but then they end up losing maybe employment. So they would come back to us. And that stability is key to the clients being self-sufficient for long term. And so based on this time that we decided to access other community resources. Like NNIC now has an in-house ESL class that we are accessing so that older clients who've been here and are still not proficient in their English can come back and access those classes without waiting for open enrollments in other institutions. And that's a big thing that NNIC is proud of, to provide for our clients. And most of the clients as well are going into like vocational trainings. We are accessing those for clients who are interested in improving their skills to maybe get better employment. So I think that's a plus for us, to be able to give one-on-one for clients who are looking for that.
Is there any other changes that you guys faced in your work with all those changes that happened?
So with the changes, I kind of realized that my work became more of prioritization. We have to prioritize needs according to the client's maybe level of what they're accessing, like their needs. We have to really prioritize, because there's some clients who are more vulnerable than others, and there's some who come in and maybe within 3 months they're doing great. And so we have to find ways to prioritize those, so those particular clients don't fall through the cracks. And more is now going into problem solving in terms of spending more effort with community coordinations, like referrals. Like we can say for the recent loss in SNAP benefits, we are finding more ways to refer clients to community resources like our local food banks and faith-based institutions.
Yeah, I feel like this is a big problem for all the not self-sufficient clients, and I know that many of our clients rely on those welfare benefits and used to rely. Could you please outline like a little bit what has changed in terms of access to those benefits for clients?
So one of the things I would say is that the biggest challenges is when public benefits eligibility narrows or verifications tighten, families can experience immediate pressure. For example, food insecurity, delayed medical care, and increased instability, especially in the first months when clients are getting established. In 2025, federal law, commonly referred to as the One Big Beautiful Bill, brought major changes affecting access to programs including SNAP and Medicaid, alongside stricter eligibility and verification requirements that can create delays or loss of coverage for some newcomers. So in real life, clients may show up with a denial letter that they don't understand, or they may be told that they need additional documentations, or may face a gap where they are not sure what they really do qualify for. So there was a lot of information that was not immediately clear to clients, and they were scrambling. So most of them were coming back like, I received all of this, I don't understand. So part of what NNIC is now focused on, and part of my job, is explaining those notices and requirements in a language that the client actually understands. So NNIC is part of, we have access to a language bank, which is a core service of ours. And so based on what the clients come with, we try to translate those documents and make sure that they're understanding what is required, and also helping them gather the right documentation to submit, either if it's a redetermination or an initial application again that's required. We are helping them to come up with those documents and submit them to the institutions like welfare who require those for them to continue to receive those services, or for them to be determined ineligible.
Mm-hmm. Do you have any information about what's going on? Like, who is eligible today for those SNAP benefits and Medicaid? Who is not eligible? Like, do you have any information you could share about that?
So far we have anybody who's not a legal permanent resident is not qualifying for SNAP benefits. And a lot of it, they're still communicating. So we are receiving that feedback from welfare when the clients do go in, and we are assessing each and every client just based on that.
Mm-hmm. So basically, for example, if the clients are still pending their green cards and they have refugee status, they're no longer eligible for the welfare benefits, right?
No.
Oh my God, how are we how NNIC supporting them then?
And that's why we are coming up with other resources like connecting clients to community resources, and also so something like for Medicaid, we are calling in clients and making sure they're enrolling with their employer. The only issue may be if there's no open enrollment at the time that they're required at the time that they actually lose those Medicaid benefits, then clients with maybe very critical medical conditions are at risk of losing that coverage and not getting straight up medical.
Mm-hmm. Regarding Medicaid, is it also for only permanent residents right now?
That's what's going on, but a lot of it is still unclear. We are just assessing on a client based. Every client is coming in with something different, and we are assessing just based on the paperwork that we are receiving. And I think they are also basing it on income. And so I can't completely say that all of them are losing it at the same time.
Okay. And do you have any strategies on how to secure clients with medical insurance?
So we are all clients who are working, we are getting with the employers to see when the open enrollment is, and we are asking employers to consider those clients to register for medical services. But previously, when clients produced a document from welfare showing that they no longer were eligible for welfare benefits, then some employers do accept for them to enroll without waiting for open enrollment, but not all employers also understand that and are accepting.
So do you have any message you would like to pass in case we have any of our clients listening to this episode?
Okay, I'm not speaking as a policymaker, but just from what we see on the ground. When essential supports become harder to access, the burden shifts to families and community systems, and it takes more coordination to keep clients stable. So I just ask clients to know that agencies are here to support, and we do our best to help them in whichever way we can so that they can feel welcome in our community and contributing members to our community.
Thank you so much, Seraphine. Whoever is listening to us right now, and if you are an NNIC client, you need any support, just do not hesitate to come over to our reception, take an appointment, meet with Seraphine, and she'll help you figure out the situations you guys are in. Thank you so much, Seraphine, for attending our episode today and sharing all the insights and specifics of work and all the changes that happened within NNIC's work after those policy shifts and the changes on a federal level. Thank you so much, and I hope to hear some other things from you soon and to have you back sometime.
Absolutely. Thank you so much, Julia, for your time, and thank you for having me here.
Thank you.